is also the medical director of Genesis Med Spa up at the Bloomsdale Medical Center, and he does a lot of different procedures up there to make us all look prettier. But there's one thing in particular that's really on cutting edge of medical aesthetics, and that's what he's going to talk about today, is SculpSure. So tell us all about it, Dr. Sharlow.
Hi, how are you? Oh, what a good-looking crew. Oh my God. Someone told me out there, beware of the hormones in that room. Honestly, a young lady told me. Well, I'm glad to be here, and I appreciate you all taking your time to listen to me for just a little while to talk about some of the things that we offer at Genesis. As many of you know, and some of you may have already taken advantage of it, we're not here at Bloomsdale, and we're part of the women's care services. Very soon we'll be located upstairs in our own private little entrance. You just walk into the elevator and go straight up, and there Brittany will say hi to you. This is our team. You see Mary Crecilius is the most recent addition to our team. Many of you know Mary. Mary's been with us. We all love her. She does a wonderful job in women's care. Patty has been around longer than I've been around, and she actually has been working with me in my general surgical practice for nearly 20 years, and in medical aesthetics since we started about actually 10 years ago. Which who you don't see up here is Brittany. Brittany, where are you? So everyone can see you. Say hi, Brittany. Brittany's the voice that you hear whenever you call and you want to make an appointment for your free consultation. No pressure. We'll share with you everything that we have. Walking into Genesis, honest and truthful, is like walking into a candy store. And I'm not kidding you, except this is candy that will not put weight on you. And all it'll do is make you look better. So we'll run through the services real quick. And our promise to you is to provide what you want to look better, to feel better. Every morning you walk, you look at yourself in the mirror, and you wonder, what can I do, and what's happened to me? I mean, we all do that. We all do that, and it hits us usually at about the time when you're starting to feel good about yourself, and then that mirror just tells a lie. So we have Smart Lipo that we've been doing. This is a way of getting rid of fat, excessive fat. It's still a service we offer. It's liposuction. It's used with a laser. So it's minimally invasive. It's not something that's going to take you down for any length of time. It takes a little bit longer than SculpSure, which I will tell you about. But it's still a very, very good service to consider. And it's a service that a lot of people feel you have to go to St. Louis to get, and that other place that promises you so much for so less. Don't be taken in, because I've had lots of people that have been there and have come back, and it's pretty incredible what they find out. But the results of this is pretty real, and this is not a made-up photo, it's a real photo. But this is the photo that we share with people so that they can understand we not only remove the fat, but we can tighten the skin. And it is a client of ours that was very pleased with her results, of course. We can do arms. We can do practically any part of your body, except this is the one procedure we don't work on calves, but we can do practically everything else. Cellulase, all of you have wondered how to get rid of cellulite, and I know you've used creams and potions and all motions and exercise, and 85% of women have cellulite. Cellulase is a way of getting rid of cellulite. It really, really works. It is a laser procedure. It's minimally invasive. There is no downtime with this. You talk to us while it's being done, and we get those legs as smooth as we can get them. But we always need consults for any of these services, because we try to tell you exactly what we can do so that you can understand exactly what's going to happen. So even though I'm running through these things, when you come in, we'll talk in detail. Those are real results, and those results can be appreciated. Most of the people, believe it or not, that I do are the young ladies. I do probably average age of about 28 years. 28, because the young girls start to begin to see this, and you see this when you're about 22, 23 years old, and it starts to develop. But you can get good results. We do skin rejuvenation, which is a laser service that we can do to take care of the discolorations in your face. You know, as we get older, we get sunspots. We can smooth that out, and we can get rid of those by using a laser that is very gentle to your face, and there's no downtime. associated with this. So ablative rejuvenation is something that actually was shown in Times Square. It really was, because when this came out, it was the hottest thing on the market about 2 years ago, and it's still very good. Those pores that you have that you try to cover with makeup, we can close those pores with this. If you have scars that's from acne when you were younger, we can erase those scars. This is basically a procedure that will get rid of very fine lines and will porcelainize your skin. It really does work. It leaves your face a little red, but after about 24 hours, that smooths out. This is a good procedure. We do laser hair removal of any. I don't do laser hair removal. You know, Patty and Mary Cracilius will do laser hair removal, any part of your body. Although I will say that a lot of young men take advantage of that. For some reason, men don't like hair on their back or their chest anymore. I never had it, but some men don't like it. We do laser vein treatment. I had a young lady out here just told me she had laser vein treated at Genesis, and she loved it. It's not associated with the pain that it used to be associated with. We have newer products, we have newer machines, and everything we do pretty much, you'd be surprised how painless it really is. Botox has been around forever, and Botox will be around forever. Everyone knows about Botox. It's a temporary paralyzing agent. We use it for frowns, we use it for a lot of folds in the hair. You know, when you, in the forehead, when you're looking like a Shar-Pei like I do, those smile lines around the eyes, we can get rid of those too. This is a very dependable product. It works. But of course, you know, Botox works for everything. They're using it for migraine headaches, for torticollis. They're using it for kids who have trouble with certain spasticity disorders. It's a good product. We basically use it for cosmetics, and it works very, very well. The injectable fillers that we've had, Juvederm, Radius, and Bellaterra, these are all fillers that we've been using for years. Juvederm is a hyaluronic acid filler. Most of you who have ever had fillers, if you started 10 years ago, collagen, collagen, collagen. Collagen from bovine, collagen is what it is, from a long time ago was always the best product that anybody could use. And then things came around that would last longer than collagen, because as you are aware, if you had collagen, it was 3 months, it was gone. But I had people coming back every 3 months because they wanted their collagen to pout the lips, or to raise the cheeks, or to fill these lines here that are called marionette lines. Radius is another different type of a filler, lasts a little longer than the Juvederm or the Bellaterra. These are for very fine lines. This I use principally for the cheeks, lasts about 18 months. And Juvederm I use principally in the lips. And really, it's a good, they're all good products. Bellafill is the newest product that we're using right now. Bellafill is, believe it or not, collagen. Now, why are we back to collagen? Well, Bellafill has with it a combination. It has PMMA, is polymethyl methacrylate. And what that is, it's almost like a semi-permanent filler. Bellafill will last 5 years. It's a pretty incredible filler. It goes in as smoothly as collagen. And even though I'm telling you I use collagen and it wouldn't last, but collagen was the best filler I ever had because it's so smooth and it's so natural. This is the same. It's just that it has something in it that makes it last longer. I don't recommend this as a first-time filler for someone who's never experienced filler, unless you're absolutely sure, because you're going to have to live with it for a while. And even when you get this in, it's not, you never go completely back to baseline. It starts to gradually decrease. But fillers are what most of us need when we start to lose and our face starts to sag and we lose that subcutaneous tissue. Even now, if you look back at people who used to get facelifts, and some of the stars, you know who I'm talking about, they look pretty unnatural. Well, a lot of them are still getting those things done, but what they're doing now is they're adding fillers, fillers, fillers. Because by replacing what you've lost in your face, you can almost approach what a facelift will give you, but it looks natural. And thing about this is no one really knows you had it done. They'll look at you and say, boy, she looks good. Yeah, you do, but they can't put their finger on what it is because it's a pretty natural product. And this works very well. This is used basically in the face for cheeks, marionette lines, for nasolabial folds, just things. And usually by placing it in the cheeks, you can get a facelift. You can also place it around the temporal area and get a brow lift. Now I do brow lifts. I use Botox for brow lifts in a lot of people, but this will last 5 years. Good, good product. All right, we'll keep moving. Precision TX. See this? Now, we can do neck lifts by using a laser. This is not taking away skin. This is basically inducing your collagen to tighten up and to draw up. With Precision TX, I can basically take a loose neck and lower face and lift. It's a real nice product. We are just introducing Precision TX. Very safe, very good. It's a very good product. Now, this will also get rid of underarm using a different technique, but we can also use this for underarm sweating, and we're approaching the hot weather. So if you're being bothered by underarm sweating, that's rather embarrassing and not being taken care of, we can take care of it. And this is a permanent treatment for it. So if you want your sweat back, it ain't coming back. So be sure, if you decide you want to get rid of this, you are ready to get rid of it. And it really does work. And these are no downtime procedures. These are, for the Precision TX, you do have to wear a little thing on your neck for a couple of days, but for the underarm sweating, really that's not much you need to wear but a dressing for a couple of days. And this works, and this basically carries with it about a 90% guarantee with it. Not 100%, but what in life is. But it works very well. Even if you don't get complete relief of sweating, 90% of people do, about 10% of people do still are very pleased with the amount of decrease in sweating that they're going to have. Now, all of you probably have heard about cool sculpting. Well, this is the next step. Cool sculpting has been around 10 years. This is SculpSure. This is not cool sculpting. This is a way of getting rid of fat without pain, without downtime, without the risk of tissue injury, and with skin tightening. Now, SculpSure uses a laser, and it uses basically the same laser I use when I get rid of fat using Smart Lipo. Except this laser is a 1060, and what it does, by just placing it across your body, and we'll show you a film, you'll see exactly how it works, it's a very short film. Then you just lay there, read a book, or play on your phone while this thing works. And I had my lower abs done. This really works. There is no pain, there is no downtime. The laser is driven through the skin. There's a cooling device on the skin, through the dermis, and the fat attracts it. It does not harm anything else. It gets rid of about 25 to 30% of fat. Now, of course, some people are not candidates for this procedure. Everyone is, actually. But some people may, if you want to have all of the fat gone, the way to do it is suck it out with liposuction. However, if you have small areas of fat, or if you've been working and you just can't quite get rid of 2 inches that you want to get rid of, this is the way to do it. No downtime. And if you don't want downtime, and you say, well, I'll get a little bit now, I get a little bit later, you can always have it retreated later. This takes about 25 minutes per area. It is a permanent result, and the question is, well, where does the fat go? Because I don't suck it out. The body takes care of that. The body wipes it out by lymphatics, and basically you pass it when you sit on the toilet and things like that. Anyway, you won't know you did though. But this, you can do this over lunch, quite honestly. It's really that easy to do, and honestly, it really does work. Let's see. Here's the video.
patient fact that you can do non-invasive, without pain, without untoward effects, and the ability to go right back to their normal daily activities. Phenomenal. Now we're offering a new service called SculpSure. This offers a way of getting rid of fat in those stubborn areas using laser that actually doesn't harm the skin, doesn't pinch, doesn't burn the skin. It's painless. You lay there and the laser does the work while you read a book or talk on the phone or text to your friend. But it works and it's proven by clinical studies to rid that area of up to 24–25% of the fat, in some cases maybe as high as 30% of the fat, depending upon the particular individual. It's not for everyone. It has to be for someone who's no higher than 30 BMI, because some individuals would still be better served with liposuction. But we'd like for you to be between the 3 and 4, somewhere between the 10 and the 1, but we don't want you going over.
She's not an actor. She's a real patient.
Longer periods, like
Tolerable?
it's definitely tolerable.
Good. How you doing? Good. Getting a little used to it. Good. You are done. So how was that?
We did very good.
All right.
Oh my God.
And we'll plan on seeing you back in 6 weeks.
Okay.
Thank you.
Really looking forward to wearing a bikini. I would always have the option to wear a bikini if I wanted to. So, yeah, I'm really excited. I'm just going to be able to go home and even if I had to go to work, I felt like I could just hop in my car and go home and have it. It's just, I'm ready to go to the dentist. Actually, the dentist room is getting this time.
And the patient that we just treated, she should see improvement in loss of fat within 6 weeks. We'll be planning on taking pictures in about 12 weeks, and I can assure you she's going to be happy.
We just wanted to share that with you just so that you can see basically how it's done. It's hard to explain. It sort of looks like something off Star. You guys see the last Star Wars movie? Kind of like something from that movie, yeah. But it really does work, and the results are just pretty impressive. Even though we will treat some small areas, like if we treat your hips, a lot of times you'll get an advantage because the heat kind of travels a bit, and you'll get it even higher. And basically, and I can talk from personal experience, basically the way it works is you first feel a little cool. Then it heats up a little bit, but then when it starts to heat up, it cools down again. Then it heats up a little bit. We work with you the first 5 minutes to get it to a level that you're very comfortable. It takes about 5 minutes, and then you just lay there. Honestly, you just lay there, and it's amazing. It's amazing. But it's like everything in medical aesthetics. Things are improving. Things are getting easier. Things are getting better. Everything is going non-invasive. And even if you go, anywhere you go now, everything is non-invasive or minimally invasive. It's kind of interesting. I was at a general surgical conference this weekend, and everything was non-invasive. A lot of you know about laparoscopic cholecystectomies, lap colectomies, lap hernias, lap appies. Everything is minimally invasive, and why not? You know, if we're granted from above to be able to do things easier, things that don't hurt, things that don't take as much out of us, then why not take advantage of it? Anyway, so I'm going to open the floor for questions, and feel free to ask me whatever you like. Yes, ma'am.
How long does it actually take for you to lose the weight?
Basically, the one important thing to you don't lose as much weight as you do fat. And you can start to see the results in about 3 weeks. It takes 12 weeks to see the final results. Now with smart lipo, with liposuction, it takes a week for the swelling to go down. There's really not much swelling with this. And that takes about 6 months to see final results. But you're taking off a lot more. As I mentioned here, 25 to 30% of fat, depending upon the thickness of the skin, the age of the patient. With skin tightening that goes along with it, it takes less off, which is why it's faster results. But the smart lipo will take 75 to 80% of fat off. That's why it takes a little longer to see those results. Yes, ma'am?
Are you familiar with that new procedure where they use freezing instead of laser?
That's cool lipo that they're using on the neck now.
Yeah.
This has not yet been cleared for it. When it's interesting. These are the dynamics that are going on right now. Cool lipo has been around for 10 years. And now when SculpSure came out, they realized that there's competition now because instead of 1 hour, it's 1 hour. It's 25 minutes. Instead of pain, there's no pain. So now Cool Sculpting is now giving you the opportunity to get something put on your neck. SculpSure is going to work on the same thing. Actually, on the West Coast, they're already using this for the neck. This essentially will be also available for the neck, but we have to get clearance on it before we can do it. The doctors that are using it now don't have clearance yet, but it can be used. But the reason you're seeing that with Cool Sculpting now is because they have felt the pinch from SculpSure, and they're having to expand their indications, and they know that SculpSure hasn't gotten that indication yet. But that's what that is. Yes, ma'am? Price range will be anywhere from $1,500 for the first site. It gets cheaper as you get additional sites done. That's for SculpSure. Now all of these prices depend on how many of those little templates you have. Now one area is 4 templates. We adjusted if we only have to use 3 templates or 2 templates. It just depends on where you're going to have it done. But for the first 4 templates, it's $1,500. Second area goes down, I don't know how much, and then the third area goes down also. It's really not, I mean, it sounds like a lot of money, but for the results that you get, it's money well spent. Because people spend so much money on dieting and exercise, and sometimes it just doesn't work.
Yes, are they covered by insurance then?
No, none of this is covered by insurance. I'm not sure it ever will be because,
It's cosmetic.
yeah, it's cosmetics.
Okay.
Any other questions? Yes, ma'am.
What did you say about the BMI level?
BMI, we say that it's best for people with a BMI of about 30 to 31. Now, when we talk about BMI, that's mainly for abs. When you look at arms, when you look at calves, even when you look love handles, inner thighs, outer thighs, sometimes the BMI, higher BMIs won't be reflected in those areas. Most of the contribution to your BMI a lot of times is abdominal. And we just want people to have realistic expectations. But this is something we can use on any area of the body. So let's say if you have a BMI of 35, of course you don't, but if you do, and you decide, well, I know it can't get rid of all of this, but if I can just get some help, you get help from it. And you can lose a couple of inches on those abs, and then come back in 6 months and get rid of 2 more inches. And you see, and then we'll make a deal with you. We always work with our clients. We always do. And those of you who are clients know that. We work with you. Patty a lot of times said if she wasn't around, I'd give the farm away. I probably would. I just want people to feel good about themselves. Okay. I thank you. Appreciate you.
Thank you, Dr. Sharlow.